I got Dave Max 6, and we are back with Dr. Rand, and this is Ask the Doc, you guys. So we're going to get started right away with the first questions. Dr. Rand, thank you for doing the show. I love it. Have you ever heard of fragment 171-191? It's a peptide that is supposed to be great, a fat burner, supposed to be extracted from human growth hormone. Thanks a lot for all you do for us, Steve.
Yeah, I'm not sure if it's extracted per se, and I don't mean to pick on the words, but it's supposedly the last fragment of human growth hormone. So, you know, human growth hormone is 191 amino acids. It's the last part, and you know, I don't see any studies out there. I mean, this is one of those things where the bodybuilding world sort of does its own experimentation, and I think it's, you know, from a scientific perspective, it's really, really cool. I don't know about from a regulatory perspective, but I don't know that much about it. I certainly can't endorse it because we don't have any tests to support its use, and more importantly, as always, the safety. But you know, like Somorelin is the first 29 of 44 amino acids in that peptide. It works like growth hormone releasing hormone. Mm-hmm. I imagine the same thing is occurring here, that it's not a whole 191 amino acids, but it's enough to trigger the receptors to do their job. Now, you know, growth hormone receptors, I mean, this could be really cool. You know, what part of the receptor or what receptors, that's above my pay grade right now to talk too much more about, although I can say, well, and of course we have to have research on it, but when I was in school, before med school, I can remember all the work over at CSUN with peptides being done, and I can remember thinking then, along with them, it wasn't like I had a bright idea because they were already working on it, but I remember thinking, how peptides are the wave. You know, the way proteins are folded in the cell, and that's a study in and of itself. Peptides are going to really be used more so in the future to manipulate the body, you know, the way we've been doing it epigenetically for a long time. This is, you know, it's pretty cool. Again, I'm giving you kind of not much of an answer because I don't know. It's too new.
But have you ever had? Sometimes you tell me that sometimes some of your patients even will tell you, "I've been using this." So you don't know anybody, any of your patients who have actually used it?
No, this one no. But yeah,
okay.
like BPC 157, right. I found out through one of my strongman competitors. You know,
yes.
I had never heard of it before, but the guy's swearing by it. We've talked about that before. Yeah. You look into it, and yeah, that's why I love. You know, going to do morning rounds at the Mecca, because I get to talk, no, really, to have bodybuilders and all kinds of athletes as clients, because, you know, you do get tips.
Yeah, awesome. Thanks a lot, Doc. Okay, Doc, what do you got?
So this is a long one, right?
Yep.
Thank you for reading my message. Sorry it's so long. I'm in my mid-30s and have low T. I have taken 3 tests over the last 2 years. My first was 180 total T. I assume that's nanograms per deciliter. My next 2 were 250 and 254 with a free T of 8.37 picograms per milliliter. In my early 20s, my total T was around 360. I don't remember exactly. I've been dealing with anxiety most of my life, with panic attacks beginning in my early 20s. I have been on anxiety medication since that time. I asked the endocrinologist if my anxiety could be caused or worsened because of my low T, which he responded they weren't usually connected. I'm not sure I'm going to be able to keep track of this. I have to reread part of this as I go on, because there's already so many things bouncing in my head here. He stated he would put me on TRT if I were in my 50s. Because of my younger age, is reluctant to do so. He asked me several times if I had taken steroids. I responded no, because I've never taken anything ever. His rationale for not putting me on it is because I can grow facial hair and can still get erections and have sexual function. My fatigue, low confidence, and anxiety appeared to be a non-factor to him. I told him I have no energy to exercise, and I do feel horrible. And I do feel horrible, I think is what he means. Yeah. My anxiety also ramps up after a few weeks of weightlifting, shutting down my training. I also feel as though my body is falling apart. Shoulder pain, digestive issues, hemorrhoids developed a few months back after a stomach flu, dry scalp issues. I don't know if they are connected to low T, but I never used to have those problems. They have come on somewhat recently. Should I insist on being put on TRT? Well, yeah. I mean, if you can, should I shop for a new doctor? Yes, if your current doctor won't put you on TRT. Remember, I can't diagnose, this is curbside service, but just based on the information given, this is not in total, boy, it sure screams low T, not the least of which, the numbers are really, really low. Now, my favorite out there in the academic / clinical world, Abraham Morgentaler, he speaks to this. They not recently, it's been the last year, released an international consensus of which he chaired. And this is the doctor, the urologist who is associated with the Harvard Medical School. He's an associate professor. He's written many books on testosterone therapy. They're now saying that you don't treat numbers, you treat people. But you really shouldn't draw a line in the sand, which actually he did for a while. He said, well, 450 nanograms per deciliter is where you draw the line, and below that, you're hypogonadal, and above that, you're not. Well, we all see the error in those ways. What if you're 449? What do that's right. Perfect. Or you're certainly hypogonadal. I guess better cases. What if you're 451? What do you do?
Right.
Lab error, fluctuations morning and night, all that kind of stuff. So he's come out publicly, along with the international group, and I think there were eight bullet points in the consensus, but one of them is, hey, treat the symptoms. Evaluate low testosterone based on symptoms, not the numbers. But once you get there, with the symptoms, in other words, it's nice to have the numbers to confirm your diagnosis clearly. And in this case, clearly, from 180 to only 360 is low. And depending upon the scale, 180, 250, 254, they're all below normal, I think, by just about any scale, unless it's just a ridiculous scale. The one I tend to look at is the LabCorp scale, which is, I think, 347 to 1197 or somewhere close to that. You think it'd be ingrained in my head by now. But I like LabCorp. This is not a commercial, but they acquired Esoterics. And Esoterics used to be the lab that dealt specifically with hormones. So I tend to trust them more, just because that's been their specialty. And LabCorp, obviously acquired them and uses their laboratory equipment and protocols. But here, this screams low T because of the numbers, certainly, but also because of the symptoms. Just because you can grow facial hair.
What is that?
It's just, I know it's horrible. It's laughable, and I don't mean to poke fun, but it's very old school, and it's really, but it does deserve a laugh, and it deserves a poke, because that's just ridiculous. I see guys with 2-finger foreheads and full-on 5 o'clock shadows by noon in the day who have low T. Yeah. That's a genetic thing, and yes, it can be what do I want to say? It can be influenced certainly by levels of testosterone and dihydrotestosterone derived from testosterone, of course. But looking at somebody and say, well, because you have facial hair and you can still get erections, your testosterone is fine. That's ridiculous. You have to look at some of the other symptoms, obviously. Yeah. And yeah, one of the things he mentions here is your anxiety levels. One of the things that comes up in my practice a lot is, and I think we've touched on this. We touched on so many things. I hate to be redundant and repetitive, but when you don't have that sense of well-being, that joie de vivre, that sense of just I feel good no matter what, you tend to get more anxious. Think about when you are getting a cold or you have a cold. Yeah. All of a sudden everything sucks and you're worried about my car payment next month and all that stuff. And normally you're like, whatever, and you'll blow half your car payment at a bar one night and not think twice about it because you feel good, right? Sorry, bad example. And that leads people to not only feel anxious, but and the two go hand in hand, have poor sleep, where typically you hear a guy or a gal not necessarily having trouble falling asleep, but staying asleep. They go through the first 4-hour sleep cycle and then wake up and start ruminating about that car payment, the 2.3 kids in a mortgage, or whatever it might be, and they can't go back to sleep because that worry takes hold, because they don't have the same feeling they had when they were 16 or let's say 20, and they woke up and were thinking about the paper they had to write the next day, and shut up, brain.
Yeah.
I'll handle it when I wake up in the morning,
Yeah.
at 5 a.m., sharp as a tack and feeling superhuman like I always do, right? So that, those two definitely go hand in hand. Of course, anxiety is a stressor, so that feeds upon itself, if you will, in that, the stressors will lower your testosterone and make you feel even less confident and
snowball.
Perpetuate your anxiety. Yeah, so I would definitely look into this. I mean, the no energy to exercise, anxiety, low confidence, fatigue. Again, I mean, I had a guy here one time from the Bronx, or Brooklyn, I think, an Italian guy who was telling me how great he felt when it came to, he had a wife and 3 girlfriends or whatever. I apologize to those that are offended by that concept or anything. But I mean, in every other way, the guy was a total curmudgeon. He had no energy. His body composition was horrible. Like I say, he was just curmudgeon. He wasn't a happy camper. But he could still function sexually just fine. And I, you have other issues where guys are doing fine, with body composition, but have erectile dysfunction and fatigue and have trouble recovering after exercise. So you can't just go, oh well, you've got facial hair and you can get an erection, so you're fine. Yeah. Okay, point made there. And I mean, look, not all doctors are the same, clearly, and some specialize more so in some things than others. So definitely get a second opinion. I mean, this is a classic example of always get a second opinion. Yeah. Even if you find a guy who says yes, you should be on a TRT. It's nice to have a second opinion. Right. A silver bullet. Yeah, I think this would solve a lot of your problems. Again, with this curbside service here of looking at what you present to me, everything tends to point in that direction. Side effects I wouldn't worry too much about, because if you do this properly, if you make sure that you take enough testosterone so that you can stop the symptoms, you can resolve the symptoms, and you control your estrogen. Okay, because this is something where I've seen a lot of docs, thankfully, that have looked into TRT and started prescribing it, but they didn't look far enough into it, and they're not covering the excess estrogen that can be produced. They're not looking out for signs of sleep apnea, which will be exacerbated because you have the testosterone leverage to increase the hemoglobin, hematocrit, and red blood cell count, because the guy is not, or gal, is not breathing at night. So they're training in their sleep with a sleep apnea, and so the H&H is going through the roof, and that'll show up. So again, as long as you're monitoring it and do it the right way, you really shouldn't be worried about side effects. You nip them in the bud. As far as some of these other things like shoulder pain, digestive issues, even hemorrhoids, dry scalp, yes, they could be related directly or indirectly. Dry scalp, if you don't have the sebaceous glands working properly, and those glands work in overdrive in teenage years. Why? Because your hormones are screaming, right? So if they're below optimal, you can have a dry scalp. Maybe a reach would be your hemorrhoids. I don't know why you get hemorrhoids from having low T, but if your digestive system isn't working well and you're constipated, then that could lead to hemorrhoids. Again, why isn't your digestive system working well? You're constipated because you're not exercising, you're not drinking enough water, you're not keeping the movement in the bowels. I mean, again, we could go on and on, but there are definitely lots of factors here that relate to low T, for sure. And I guess when I read this one, the biggest thing is anxiety and low T definitely are not necessarily things that two people put together, but that's a big one.
Awesome. Thanks, Doc.